Aphakia. Aphakia is absence of lens. So when can this happen? This can happen when there is congenital absence of lens or surgical removal of lens or because of absorption of lens matter post-trauma, or it can be because of traumatic extrusion or posterior dislocation in vitreous. So what happens to the optics in aphakia? So optics in aphakia, first of all, people will become hypermetropic. So therefore the power is hypermetropia. And next, the power from plus 60 diopters of the eye will come down to plus 44 diopters. Finally, there will be total loss of accommodation. So the accommodation will be completely lost. So these are the changes in optics in aphakia. Now moving on to symptoms. So what happens to distant and near vision? So both the distant and the near vision will be defective. So therefore there will be defective distant and the near vision. And apart from that, people will be complaining of seeing blue and red images, which is called as cyanopsia and erythropsia. Cyanopsia and erythropsia. So cyanopsia is seeing blue images and erythropsia is seeing red images. Now what are the signs? So coming on to signs, a limbus, you can see a surgical scar near the limbus. Anterior chamber will become deep in these patients. Coming on to iris, there can be mild tremulousness of iris, which is called as iridodenesis. So there can be iridodenesis. Pupil becomes jet black in color. So it will be jet black in color. Coming on to Purkinje images, normally you will see 4 images in this test, but here you will see only 2 images. So these are the signs you can see. So how do you treat this condition? So treatment mainly involves giving convex lens to these patients. So it's about convex lenses. So now how can you give this lenses? So either by means of the contact lens or it can be intraocular lens implantation. Surgical correction of the power is either through keratophakia, epikeratophakia or hyperopic LASIK. Now can you give spectacles? Now giving spectacles to these patients, what is the disadvantage it imposes? Usually the image is magnified by 30% with spectacles. So therefore if you're going to give to people with unilateral aphakia, they can develop diplopia. So therefore it causes a side effect of diplopia. And usually it limits the field of vision. And finally it also causes roving ring scotoma, which is also called as jack in the box phenomenon. So therefore you better don't prescribe spectacles for these people. So now when you move on to this MCQ, jack in the box scotoma is a feature of which of the following? So as we discussed, roving ring scotoma, jack in the box is a feature of aphakia. So therefore your answer is aphakia.